Well, those living with migraines can tell you just how debilitating they can be. Luckily, with medical advancements, there are medications to surgeries that can help. Here with details in our continuing coverage during Migraine Month is Dr. Brian Loftus. And last week we talked about some of those generic medications that can help folks with migraines. Today we're going to talk about the more expensive options, and I guess probably at last resort, the surgeries. So what are some of the surgeries that folks can opt for when it comes to migraines?
So the one that has the best data to show it's helpful is when they put in these force stimulators around your head. And it's commonly called the Omega procedure. And that should, again, only be done when you've tried 5 or 6 other things first, and you've seen a headache doctor or 2 even. But those clearly do help folks. They don't help, unfortunately, quite as well as I think the advertised billboards would imply.
Right.
European studies show that half the people need a surgery, a positioning surgery a second time after the first time. So there's common that people go back to the OR for them, but they definitely help.
Now, what are we talking cost-wise for that?
If insurance doesn't pay, like $60,000.
Yikes.
So those are very expensive.
Yeah.
Less dramatic surgery are these trigger zone decompression surgeries, either the occipital nerve or some things on the face, and that is a very controversial area of medicine right now. The American Headache Society position is those should only be done as part of an actual clinical trial. It's not proven therapy. It's been basically stopped in Europe at this point.
Okay.
So definitely some folks seem to be helped, but some folks may end up worse, and picking the right patients is hard.
Okay. And then I know there's Spinocath.
Spinocath is sort of more of an acute care. So there's a whole group of devices that are coming that block what's called the sphenopalatine ganglia, or SPG, which is easier to say.
Yes, it is.
And those SPG blocks hold out hope for a preventative role, and they definitely have an acute pain role. Also coming down the pike in studies are CGRP injections, and these are all drugs that affect the CGRP system, and there's several that are entering trial now. So
and those can actually be performed in the doctor's office, typically.
Yes, all those procedures short of surgery are typically done in the doctor's office. So we do the Spinocath in my office. It's nice for people who are pregnant where there are very few options, and we also have used in folks who other things just don't work, but we use it for a relatively small amount of time. And
how do you decide that that's what you're going to do?
If they're pregnant, we don't have that many options, so usually it's towards the top.
Right.
But if you're not, usually you failed at least 3 or 4 of the prior drugs, and then while we're trying drug number 5, we'll be doing something like that or some other nerve block procedure at the same time. Or sometimes if you're just desperate. It's amazing how many folks have had their headaches for years, and they've been every day for 3 years now, but something is different now and they just can't live another day, and then we'll do something like that while we start them on a different preventative plan.
Now, I know that there are a lot of folks out there who live with these headaches. What do you tell those folks that just haven't come in yet?
Well, they can choose to be, miserable if they want to. I always tell the adults that, it's okay if you don't want to take therapy as long as you know what your options are. So they at least should come in and hear what their options are. They can go to the Bel Air Neurology website and go down the preventative page, and it lists all this kind of 7 top drugs and their pluses and minuses. And if your headaches are bad enough that it's worth taking a pill each day so you don't have it in the first place, then they need to see someone.
It's a preventative daily thing, and if you can be without the pain, it seems kind of like a no-brainer to most folks.
It does to me, but you'd be amazed. Each day I see someone who has headaches for more than half the days of their life, and of those, about half of them have never seen a neurologist before, and they've been living with it for a number of years. They just thought it was just kind of normal.
Well, a lot of people probably don't know where to turn. A lot of people have probably gone to their general practitioner or another doctor and didn't know a neurologist is where they needed to go.
That's possible. It could also be that if your mother had horrible migraines with her menstrual cycles, you just thought it was part of having a menstrual cycle.
Is it genetics?
Headache. It is a genetic disease. For the most part, there's at least 25 migraine genes that have been found to this point.
So we can thank our moms.
Or dad.
Or dad.
But,
so thank your parents if you've got a migraine.
If that's the worst thing your parents did To you,
You're
they've done okay. That's right.
And what are we going to talk about next week?
Some of the acute drugs. So what your doctor should do when you have a headache.
All right, and we'll also answer some of our viewers' questions. And we'll be right back with more Live at 5 after this.